Largest defects commonly present with shortness of breath, easy fatigability, palpitations, recurrent respiratory infections, exercise intolerance, chest discomfort. Clinical signs include wide splits of S2 heart sound, systolic murmur heard over pulmonary area, right ventricular heat.
So here during small ASD, there is no more pressure changes are there. So it causes less common symptoms like any murmur or any flow difference gradient at all during echocardiography. But in later it will turn to larger things. It can cause sinuses and it will lead to congestion like pedal edema. And in ECG it can cause atrial fibrillation. Later it can cause stroke, and last it leads to congestive heart failure. Majorly it is right side heart and turn it's if it is an Eisenberg syndrome, it turns to left heart failure. And the diagnosis is.
And here echocardiography is a primary diagnostic tool for an atrial septal defect. So here the imaging views are showing that the subcostal view is superior for visualizing the intraatrial septum because it is perpendicular to the ultrasound beam. So other essential views are included apical 4-chamber window and parasternal short axis window for ASD.
Clinical examination and investigations. Okay. Investigations include echocardiography, ECG, chest X-ray and catheterization.
Okay. In echocardiography, the shunt is in ECG, there is an
ASDs commonly shows right axis deviation, right bundle branch block, signs of right atrial and right ventricular enlargement, sometimes atrial arrhythmias like atrial fibrillation. These changes occurs due to the overload of the right side of heart.
So here the right side heart get overloaded because of flow from high chamber to lower pressure chamber. So right side heart arrhythmias are present, that is right ventricular hypertrophy, which leads to RV strain pattern, RVBP et al. Okay, next right axis deviation. Next thing is
and here which is critical for confirming the defect, that is ASD or VSD. Here the color Doppler shows a distance between left to right shunt in a left atrium, that is blood moving from left atrium to right atrium. So across the defect, hemodynamic assessment, that echo quantify the shunt severity, that is QP by QS, so which is evaluate the right ventricular systolic pressure and measures the right atrium.
It is a gold standard method for diagnosing ASD. Okay. It helps to visualize the opening in the atrial septum, identify the type and size of the ASD, detect left to right shunt of blood, assess enlargement of right atrium and right ventricle, evaluate pulmonary hypertension and complications.
So in echocardiography, we can detect, we can know first thing that is there is an presence of shunt between the intraatrial septum. That is echo dropout present in between the intraatrial septum, and Doppler assessment will show that there is some type of blood flow between the right atrium to left atrium or left atrium to right atrium. If it is left to right means left to right side of the heart, some flow gradient will be noted. So in Doppler assessment will show the pressure flow, left to right shunt and pressure gradient also. Through the management?
In management depends on the size of the size and detect the severity of symptoms. Okay. Medical management, small ASD is usually asymptomatic, require observation, diuretics for heart failure symptoms, antiarrhythmic drugs for arrhythmias, prevention and treatment of respiratory infections. In surgical management, it is device closure and surgical part. In device closure done using catheter-based techniques, commonly used for secondum type of ASD. Surgical repair, open heart surgeries with stirring or patch closure. Done for large or complex airways.
Sometimes suturing or patch closure will be preferred in open heart surgery. Then it is an early treatment given for excellent prognosis, and they prevent the complications like pulmonary hypertension and heart failure. And the conclusion is about atrial septal defect is a common congenital cardiac disorder. It is characterized by opening within the atria and leads to the abdominal blood flow. Though many patients remain asymptomatic, initially it is untreated ASD, complications may be later in their life. So if it is early diagnostic through the echocardiography and timely management, either medical or surgical, which significantly improve the patient outcome and the quality of life. Thank you all.